Hey everyone, welcome back to Movement Through Motherhood. I'm Laura Bennett, and today we're tackling one of the biggest sources of confusion out there: exercise during pregnancy. I can't tell you how many times I've heard someone say, "Isn't it risky to work out while you're pregnant? Couldn't that cause a miscarriage or hurt the baby?" And honestly, I get it. There's so much noise online, and even well-meaning friends or family can pass along these old myths. But here's the thing: the research just doesn't back up those fears. In fact, the 2019 Canadian Guidelines for Physical Activity During Pregnancy are really clear. Regular, moderate-intensity exercise is not only safe for most people, it's actually recommended. We're not just talking about gentle stretching either. There's solid evidence that staying active helps lower your risk of gestational diabetes, high blood pressure, gaining too much weight, and even postpartum depression. So skipping exercise, that can actually increase your risk for those complications, not the other way around. I remember working with a first-time mom, let's call her Emily, who was so nervous about moving too much. She'd read all sorts of scary stories online and was convinced that even a brisk walk could be dangerous. But after we went through the facts together, and she saw that the real risk was in avoiding movement, not in doing it, her whole outlook changed. She started with short walks, built up her confidence, and by her third trimester, she was the one encouraging other moms in her group to get moving. It's amazing what a little evidence and reassurance can do. So, let's talk about what kinds of movement are actually best during pregnancy. The good news? You've got options. Walking is fantastic, easy, accessible, and you can do it pretty much anywhere. Swimming is another favorite, especially if you're dealing with joint pain or just want to feel a little lighter for a while. Prenatal yoga and Pilates are great for flexibility and core strength, and they're usually designed with pregnancy in mind. And then there's the bird dog exercise. If you haven't tried it, it's a simple move you do on all fours, reaching out opposite arm and leg. It's gentle on your core and helps with posture, which, let's be honest, is a lifesaver as your center of gravity shifts. Now, there's this old rule floating around about not letting your heart rate go over 140 beats per minute. I still hear it all the time, but honestly, it's outdated. Your heart rate naturally goes up during pregnancy, so tracking a specific number isn't really helpful. Instead, use what we call the talk test. If you can carry on a conversation, like say, recite the alphabet or chat with a friend, without gasping for air, you're probably at a safe intensity. It's a much more reliable way to gauge how you're doing. And if you're new to exercise, or maybe you weren't super active before pregnancy, that's totally okay. My best advice? Start slow. Maybe it's a 10-minute walk today, and you add a few minutes each week. The key is to build gradually and listen to your body. There's no prize for pushing through discomfort. Consistency is what matters, not perfection. Of course, safety always comes first. There are a few red flags you should know about. If you ever experience vaginal bleeding, dizziness, chest pain, painful contractions, or any kind of fluid leakage, that's your cue to stop and check in with your OB/GYN or midwife. And honestly, if something just feels off, even if you can't quite put your finger on it, it's always better to pause and get it checked out. Now, let's talk pelvic floor health, because this is one of those topics that gets a lot of buzz, but not always a lot of clarity. I teach what's called pelvic floor awareness. Here's a simple way to try it. Sit on a chair with your feet flat, take a deep inhale to relax, and as you exhale, imagine gently lifting the area between your pubic bone and tailbone, like you're drawing up an internal hammock. Try not to squeeze your thighs or glutes. It can take a little practice, so be patient with yourself. I'll never forget teaching a prenatal yoga class where we went through this exercise. Most of the group had heard of Kegels, but when we broke it down step by step, you could see the light bulb go off. It's not about clenching as hard as you can. It's about gentle, mindful movement. And honestly, once you get the hang of it, it's a game changer for both pregnancy and postpartum recovery. All right, that's a wrap for today's episode. Remember, movement during pregnancy is about feeling good, staying safe, and tuning in to what your body needs. If you want to review anything we talked about, check out the links in the description. And as always, move with confidence and listen to your body. See you next time on Movement Through Motherhood.